People with HIV are being diagnosed late because hospitals and GP practices in England and Scotland are ignoring guidelines and failing to carry out HIV checks. Dr. Faye Kirkland, who is a GP and a reporter, has the story.
In the UK, more than 100,000 people are living with HIV. About 18,000 people in the country are thought to be living unaware of their infection. Last year, nearly 40% of adults diagnosed with HIV only found out in the late stages of infection, often meaning they were more unwell, more likely to be admitted to hospital, and had longer to unknowingly pass the disease to their sexual partners. To tackle this, 8 years ago, the British HIV Association, who advise on HIV care, issued guidance saying that in the high-risk areas shown here, where there are more than 2 in 1,000 people diagnosed, GPs should consider offering all patients an HIV test when they register, and also in hospitals when patients are admitted for urgent medical care. In 2013, the guidance was strengthened, saying this should now happen. It's backed by Public Health England. Here in St Thomas's in London, they have the highest rates of HIV in the local community in the whole of the UK. So for the last 14 months, all patients over 16 who have a blood test here in A&E are also given a test for HIV, unless the patient decides that they don't want it. So patients are given a leaflet on arrival, and there are posters explaining about the testing scheme.
The benefit for these patients is enormous. We're literally talking about saving someone's life. If you can detect HIV before someone gets sick, you can offer them treatment and prevent further illness. In the old days, we would mainly diagnose HIV in sexual health clinics and antenatal settings, well, because that's where most of the testing was. We're actually diagnosing twice as many people in the emergency department as we are in sexual health, which is extraordinary. We can also see the impact on inpatient admissions, so by picking people up earlier, we're preventing people getting sick and being admitted to hospital. And we've seen a 15% drop in inpatient episodes since we started this project. That more than offsets the cost of testing.
In England, local authorities are responsible for funding HIV testing in high prevalence areas. 82% of these hospitals are not testing in this way, and 70% of local authorities are not funding all GP practices to test patients when they register. Scotland has 2 high-risk areas where the local health boards do not offer testing in line with best practice.
This failure to fund and this failure to test is risking lives, it's costing lives, and it also is costing new infections. HIV testing is one of the very best interventions in terms of cost effectiveness. What's been shown in many studies is that the barrier to testing is not patients. Patients, when it's explained to them why it should be done, people accept the test. But staff members feel uncomfortable, they don't like to discuss HIV, the stigma of HIV comes out and comes forward.
The Department of Health spokesperson said, while councils have had to make savings, they've also shown that good results can be achieved at the same time and are best placed to understand where money is best spent. Significant progress is being made to diagnose HIV early. And a Scottish Public Health Minister said, prevention of HIV infection remains a priority for the Scottish Government. The BEVA guidelines are good practice, and we would expect boards to take them into account while developing their local strategies.
HIV affects everyone, and what we've seen in this population is many more white heterosexual men, slightly different to the population we see in sexual health. And that's a really important message. Everyone needs an HIV test. If you just focus on populations where traditionally we've seen more HIV, you will miss the diagnosis.
Local authorities are keen to point out that they do fund testing in other settings, such as sexual health clinics, but experts say this strategy alone is resulting in patients with an undiagnosed infection slipping through the net.
And Dr. Faye Kirkland is here. So tell us why local councils are not funding.
Well, the guidelines that you just heard about are actually were also co-authored by a number of organisations, and one was the local government association. So in England, there are 152 local authorities where they've got responsibility for funding public health services, and a third of them are in high-risk areas. Now, I asked the local government association if they signed up to this, why councils aren't doing it, and they told me that there's been a squeeze on the budget for public health by the government in England, and they're very keen to point out that they do test in other settings, so in sexual health clinics. There are no high-risk areas in Wales or Northern Ireland.
But we heard in the film, some GP surgeries are not testing even when they are funded. That's
right. So I asked all the councils who are funding all the GP surgeries just how many surgeries are actually doing it. One council told me that although they were happy to fund all the GP surgeries, none of them have taken them up on that offer. And on average, nearly 60% of GP surgeries do take up the offer, but 40% don't. So I asked the Royal College of GPs why that was, and they told me that there are multiple reasons, but one was the severe shortage of GPs, and often when these schemes are implemented, they think that staff get ineffective training on just how well it is to sort of manage it.
So what does all that mean for patients then?
Well, I showed all our findings to 4 leading HIV charities, so the Terence Higgins Trust, the British HIV Association, the British Association of Sexual Health and HIV, and the National AIDS Trust. All said for patients, this may mean that some patients are being not diagnosed until the late stages of their infection, which means patients end up in hospital, more unwell, or they could unknowingly pass the infection to other people. But not only that, they say obviously it's very good for patients, but it's also cost effective for the NHS.
OK, thank you. Thank you very much. Plenty more on the story on Radio 4's You and Yours at 12:15 today. Let's talk now to Vanessa Roberts, who was diagnosed with HIV in 2014 after living with the virus unknowingly for over 30 years, which just seems astonishing.
Yes, it's a rather unbelievable story, isn't it? But it's my story.
Tell us when you first started having symptoms and how old you were.
Well, looking back, I suppose symptoms first started appearing when I was in my early 20s, but I didn't recognise them as being symptoms of HIV infection.
So it was things like what?
OK, it was things like skin infections, ear infections, verrucas, lots of sort of little niggly things, bronchitis. Things like that. I couldn't breathe very well through my nose. I had my adenoids out twice because they grew back.
Right.
And as the years went by, those symptoms kind of got worse, but there was nothing really major that made anybody concerned that there was something seriously wrong with me. And certainly during that time, nobody ever suggested I get a test.
And it never occurred to you?
No, because...
why would it?
Well, I'd been aware, you know, when I was young that I may have put myself at risk, and I was very aware of the campaign in the 80s about HIV/AIDS. But I went on, I got married, I had 2 children who grew up healthily, and I kind of assumed I didn't have it, put it to the back of my mind, didn't think any more about it.
So how was it that you came to be diagnosed a couple of years ago?
Right, well I had a medical problem that wasn't sexually related, but I couldn't get an appointment with my GP for 2 weeks, and I knew that I could get treatment for this at the gum clinic, and they had a drop-in, so I took myself to the drop-in. And I got the treatment for the thing I had that was a minor thing. And while I was there, they offered me this routine blood screening test that they offer everybody at the sexual health clinic. And I accepted it because I kind of didn't want to be difficult, really.
Right.
You know, when you go to the GP and they say, we have a student, is that okay? And you say yes. So I accepted the test, thought nothing more of it, didn't expect it to show anything at all. And 3 days later, I got a text message while I was at work from the clinic saying, please phone us immediately. So I'm actually a grief counsellor by profession. I went into a private room and I phoned up, and they said to me, you need to come back to the hospital immediately. And I said, well, what on earth for? You know, and they said, there's a problem with one of your tests. And I said, I'm not coming unless you tell me what it is. And they said, you're HIV positive. And I felt as if my world was falling apart. My knowledge of HIV went right back to that campaign in the 80s. I thought I was going to die by the end of the week. Do you know what I mean? It was really a very, very frightening thing.
What were your immediate concerns about the diagnosis?
Well, the main one was that I thought I would die immediately,
right.
which was illogical, really, but you know, that was what was in my mind. My other concern was for my children.
Who then were 25?
In their 20s, yes, in their early 20s. I was very concerned about them. My daughter had donated blood in the past, so I thought she was probably okay. But I was concerned for my son and for my husband at the time, and my ex-husband, who was the father of my children.
Were you able to work out how you contracted the virus?
Yes. From the various blood results that were taken, the doctors established that I'd had the virus for a very long time. And then looking back at my medical history, my sexual history, it had to predate my first marriage. And I had an episode when I was 19, in 1983, while I was at university in Aberdeen. I was hospitalised with a mystery virus, that's what it was called. I had been having a relationship with a guy from Malawi who was a visiting student at the university, and I was hospitalised for a few days, and then I was told, you've had a virus, we don't know what it was, but it's gone now, you're fine, you know, and that was it for 31 years.
Do you think then a test, a mandatory test like we were talking about earlier, would make a huge difference, a bit of a difference, some difference?
I think it's absolutely vital, and I'll tell you why. When people these days are diagnosed with HIV and they get on the medication, the medications these days are pretty non-toxic. There are very few side effects. You can live a normal life with them. You also quickly become something called undetectable. And this means that the viral load, the viral level in your blood is so low that you're uninfectious.
Right.
And you can't actually transmit the virus even through unprotected sex. So it's absolutely vital for everybody that has this virus in their body to become aware of their status, to get on the medication and to become undetectable, and that way we eradicate the virus. It's all very well looking for a cure, and I hear that's still a few years down the line, but by everybody that being tested, put on the medication, we can eradicate this, and surely that's the best course of action.
And now you have accepted the diagnosis, had time to reflect on it. You are incredibly smiley and positive. I can see that for myself.
Yes, I'm not a victim, and I'm not into self-stigmatisation, which I have experienced from some other people that are living with HIV. Stigma is real for those of us living with this. It's not an easy thing to admit you have. I feel actually that it's enriched my life. I'm very fortunate in that I'm surrounded by accepting, positive people. My 2 children and my 2 ex-husbands don't have the virus. That was another very fortunate thing. I've travelled to America and met up with women living with HIV there. I try and tell everybody about it, that, you know, for me it's a bit of a non-issue now, although I appreciate for many it is still a big issue. So it's for those people that I'm here speaking.
Well, thank you very much, Vanessa. Thanks
You're
for coming
very
on our
welcome.
programme.
Thank you.
Vanessa Roberts.